Human blood group system. The human blood group system is a method of classifying human blood based on the presence or absence of specific antigens on the surface of red blood cells and antibodies in the plasma. There are two main blood group systems worldwide. Number A, ABO blood group system, and number 2, RH system. Number 8, ABO blood group system. This system is based on the presence of two antigens A and B. There are four main blood groups in this system. Here is the classification. Blood group A, antigen on RBC, A, antibody in plasma. B, can receive blood from A group and B group. Can donate A and AB. Blood group B, antigen on RBC is B, antibody in the plasma is anti-A, can receive blood from RO. Can donate B and AB. Blood group AB, antigen RBC A and B, antibody in plasma none. Can receive blood group A, B, AB and O, universal receiver. Can donate blood to A, B. Blood group O, antigen on RBC, none. Antibody in plasma, anti-A and antibody B. Can receive blood from O, can donate blood to A, B, AB, O, universal donor. The RH factor is another antigen. If a person has the antigen, they are RH positive. If a person lacks the antigen, they are RH negative. This leads to 8 common blood types: A positive, A negative, B positive, B negative, AB positive, AB negative, O positive, and O negative. Blood transfusion capability. O negative is the universal donor and AB positive is the universal recipient. Importance of blood grouping. Crucial for safe blood transfusion. Important in organ transplantation, pregnancy care, and medical emergency. Prevents immune reactions that can be life threatening.